Hello.
Hi, how are you?
I'm doing well. How are you?
I'm good.
My name's Haley. I'm going to be your nurse practitioner today. Um, and can you just confirm your name and birthday for me?
Moody, 8/20/96.
Perfect. What's bringing you in today?
So I had a fall a couple days ago, and I've had a throbbing headache on the right side of my head and a pain in my right wrist.
Okay. When you fell, do you know if you hit your head?
I don't know. No, I didn't hit my head. I never lost consciousness or
Okay.
like that.
I'm assuming maybe you landed on your wrist since you're having some wrist pain.
Yeah. Yeah.
Okay. I heard you say throbbing with your headache. Is it? So it's throbbing. Is it like it's like shooting anywhere else, or it's kind of like localized to that area?
Isolated.
Perfect. Okay. So other than like your right wrist pain and your right-sided headache, are you having any other symptoms?
No.
No? Okay. Perfect. That's a good sign. Have you tried any of over-the-counter medications?
Yeah. I did.
Do you know what you tried?
Oh, I have it here.
It's in your current medication list?
Yeah.
I actually have access to that. So give me one moment. So it was probably your meloxicam. Does that sound correct?
That's definitely what it was.
Okay, I'm just going over your health history really quick as well. Looks like you need to take some medication to see your meloxicam, your valsartan, your other, you take a statin. We take some meds for your overactive bladder, some metformin. So it looks like in your history that you have some degenerative disc disease. Is that correct?
Yes.
Okay. Have you ever had an episode like this in the past where you've had this right-sided headache and right-sided wrist pain?
No.
Okay. And when you were taking that meloxicam, was it giving you any type of relief?
No, not really. Nothing's been helping so far.
Okay. Still just like the throbbing pain even when you're taking it?
Yep.
Okay. So I have your meds here. Looks like everything is current. And then I have listed here you have a sulfa drug allergy, which gives you shortness of breath. Is that correct?
Yes.
Do you have any other allergies
Um,
to medications?
medications. Um, no, not medications.
Okay, perfect. Okay. Well, if it's okay with you, now that we've kind of done that review, I am going to do just kind of like a physical assessment on you. So with this physical assessment, I'm going to do a couple different areas. So we're going to go over your neuro assessment. Then we'll do a musculoskeletal exam, and then I'm going to check your chest and lungs, and then listen to your heart as well. If that's okay with you.
Yep.
Okay. So first, what we're going to do is we're going to test your cranial nerves. So let me grab my pen light here. Actually, first, before I do that, I'm going to grab a quick set of vitals on you. Go ahead and give me one of your fingers. Just let that sit there. And then give me this arm to the blood pressure. Just let that relax. Get this arm relaxed. On those tests was perfect. All right, your oxygen is 99, which is great. Your heart rate is 74. Perfect. Okay. So next, where did I put? Okay, I have my pen light. Let's see. Okay, so I'm gonna check your eyes. I'm gonna do kind of just a lot of different things just to see your reactions to your pupils, and to make sure that all of your field of gazes are appropriate. So first we're gonna do your concentration. Okay, so don't move your head, but follow with your eyes. Perfect. Okay. Let me go ahead and just stare at my nose. Perfect. All right. Go ahead and cover your right eye. And then we're going to check your fields of vision over here. Okay, ready? Tell me how many fingers I'm holding it. Okay, then switch your other eyes.
2, 3, 2, 1.
Perfect. Okay. So let's also check. Your pupils look good. Your field of gaze looks good. So here I'm going to have you go ahead and bite down with your teeth. Yep. Okay, now go ahead and open your mouth really wide. And then go ahead and close your mouth again. And then try to open against me. Perfect. Okay. Let's do. Okay, so we're going to check your facial nerves. So close your eyes really tight. Really tight. And then open them really wide. Perfect. Smile for me. Frown. Puff your cheeks out. Okay, perfect. So I'm going to do a whisper test. You just tell me the word that you hear. Sorry, the laughter as well.
Yeah. I know.
Okay, ready?
Oh.
Okay, perfect. So let's go ahead, open your mouth and say ah. Open. Perfect. We previously checked your gag, so I know that is intact. And then for your hearing test, we also already have completed the Weber and Neurons test, so we're not going to repeat that. Go ahead and swallow for me. And then go ahead and what I'm going to have you do is you're going to, I'm going to have you rotate your head, but I'm going to push against just to see if you're able to do it with resistance. And I'm going to do the same thing with your shoulders, okay? Go ahead and twist against. Perfect. Other side. Perfect. And then go ahead and shrug your shoulders. Perfect. Okay, now stick your tongue out. Put it up. Put it down. Perfect. Okay. So, neuro exam looks great. So, basically what we're going to do is I'm going to check your grip strength, and then I'm going to see how your ankles do with plantar flexion and dorsal plantars. So after that, we'll just kind of do passive range of motion and check your gait, and then I'll listen to the rest of your chest and lungs, and we'll go from there. Okay, so go ahead, put my pen light away. Your hands, squeeze my fingers. Squeeze them. Perfect. Okay, now put them up like this. Push against me. Okay, now pull towards you. Perfect. So we're going to do the same thing with your feet. Put your feet up, down like a gas pedal. Up towards your and then just gonna check to make sure any pain or anything with that. Same thing, no pain. No pain, perfect. Okay, and I'm just gonna check your gait for me. Go ahead and stand up. And then you can kind of just walk over there a few steps. Perfect turn. Come back. All right, looks good. So now I'm just gonna check your chest. And with that, I'm going to listen to your breath sounds, check your different locations of those valves just to see if you have any abnormalities or murmurs or anything like that within your heart. And that will be the end of our exam. So And sit up for me. Take a deep breath. Deep breath. Okay. And then lean back. So now I'm going to listen to your heart and all your different valves. Okay. No murmurs. No friction rub or anything like that. No crackles within your lungs. Your bases sound very clear, which is good. Um, I also was able to check your respiratory rate, which is normal. It was at 18. It looks like your chest is symmetrical, which is great. Let's see. No use of accessory muscles, also good. And yeah, no abnormal lung or heart sounds, which is great. So basically what we do at this point is I think for you, we should do some CT scans for multiple reasons. One, a CT scan can check your head. Sometimes we have falls, and we do have, actually, we do one thing. Is it tender here by chance? Is it tender here by chance?
Yeah.
Yes. Perfect. Okay. So since you do have some tenderness there, I think we should go ahead and get some CT scans. CT scan will show if we have like any type of, we'll call it damage to the inside. Sometimes when we have falls and we hit our heads, we do sometimes lose consciousness and we aren't aware of it. And when we hit our head, especially from standing from falling, we can sometimes have something called a hemorrhage, which is basically bleeding. So we can see if you have maybe like a subdural hematoma or something like that, which is just a form of an intracranial hemorrhage. We'll also get an X-ray of that right wrist since you're having pain with it. Pending you have a fracture, or even if not, we will consult with orthopedics. That way we can either get you physical therapy, or we can get that immobilized for you or reduced depending on what's going on. And then in the meantime, though, what we will do is, one second. I think you probably have some type of hemorrhage due to trauma, right? From hitting that head, potentially a fracture of that right wrist. If not, maybe we just have a post-traumatic headache going on, or maybe just some of your chronic conditions are exacerbating and it's causing some of this pain, which I think is very unlikely. But with that, so I already told you we'll do a CT scan, which will check for all of that. And then we'll also probably do some blood work for you, a CBC, a BMP, a lipid panel. Already told you about the orthopedic consult. And then for pain management, continue taking that meloxicam. I know it's not helping, but it is an NSAID which can help with any inflammation that you have going on, which if it's trauma related, you probably have some inflammation. You can also try taking some Tylenol to help with pain. And then also just rest and make sure you stay hydrated, drink lots of water for your wrist. So we'll wait for the imaging to come back for that. And we'll wait for our orthorex as well. Beyond that, though, we'll do something what we call RICE, which is rest, ice, compression, and elevate it. So try not to use that wrist, rest it, elevate it up on like a couple pillows, heart level and above. Compression, so we can like put a wrap on it, and otherwise just ice. You can ice it for like 20 minutes at a time. Take the ice off just so we don't damage the integrity of your skin. And then we will get a follow-up visit in 1 to 2 weeks, just to see how everything is going. And then ask for some just education to prevent stuff like this in the future. So this was all most likely caused by a fall. So you need to make sure you're wearing safe footwear. If you are wearing slippers or stuff in the house, make sure they have backs. Make sure they're grippy at the bottom. Make sure if you have throw rugs on the floor, you remove those. There's not clutter on the floor, other things to fall over. Maybe install some handrails and things like that. And then, so you're already familiar with your other chronic conditions, so just make sure you're aware of any of the warning signs of those, which I'm sure you've been taught in the past that if any of those would exacerbate, you would get medical attention. And then as for your current medications that are within your list that we reviewed, keep taking those as you're supposed to, and that is it. And we'll wait for imaging and we'll go from there. Does that address all your needs?
Yes.
All right.